Hi, this is Team 20 and we are from George Mason University in Fairfax, Virginia. This is our solution to addressing hunger through Bits and Bytes. The problem we look to address is how can we help seniors and the disabled meet their nutrition needs. The data we found is the current disabled population is around 8% of the total Virginia population, or around 682,841 people. According to the Roadmap to End Hunger, the senior population is expected to double by 2030 to about 3 million people.
So, before we get into our analysis, I wanted to break down our data and data sources. To begin, we looked at food accessibility data from the VDH. This had a lot of important variables to us, including our response variable, which is food accessibility, which for us was the proportion of low-income individuals at the census tract level within a reasonable distance of grocery stores. Now, from there, we wanted to bring in some demographic data, so we brought in some from the US Census Bureau, the most modern of those samples. Continuing that, we then went into the Open View American Community Survey, as well as the Social Vulnerability Index, to help supplement our data sets in quite a few ways. Now, looking at this plot of Virginia, we see all of these census tract levels with the variable age and the average of those for each county. One of the things we were looking at was those older generation populations that had over an age of 65. And what we found was that there were clusters of them kind of spread sporadically, but following around city regions. Now, if we compare that to our next graph, we see all of these counties highlighted are areas with low disability index scores. Now, you might be asking, why did we map low disability index scores? The reason that we did that was because we recognized pretty early on that these regions with low rates of disability prevalence ended up having walkability challenges. Further, when looking at that variable of food accessibility, one thing that we saw was that areas from those low walkability scores ended up also correlating for those lower disability regions, i.e. indicating that those regions that had less people with disabilities had further walkability challenges that resulted in food accessibility challenges.
In order to find these areas with low food availability, what we will do first is to test the different population subsections and see whether or not they are significantly different from each other. In our case, we found that rural and urban areas are significantly different and therefore require different models in order to determine food availability structure. Because of that, we will be going forward looking purely at urban areas for this research. In order to find which predictors would best allow us to determine the food availability of an area, we take our available data, which we have gleaned from the Virginia Department of Health sources as well as the Census Bureau sources, and we use a process known as backward predictor selection, in which we use to determine the most significant variables. Once we know which ones are the most significant, we go forward with the beta regression model in order to determine what sort of correlation we have when it comes to food availability with our important predictors. And from there, we fit our models based on our different population subsections as aforementioned. Once we do fit the data to a regression model, what we found is the following to be significant predictors when we're trying to find areas of low food availability. So these are such as walkability, which includes public transportations and sidewalks, access to a primary care physician, the racial segregation of a community, the standard of the community, as well as the educational quality of the citizens. We found these to be the most significant in predicting where areas of food availability is.
Solutions we aim to provide for these identified problems were first using drones, both aerial and ground-based, to deliver at least a 5-day emergency supply of food within a 15 to 5-mile radius, respectively. To help our senior population better adopt into the drone program, we would like to incorporate SNAP centers. SNAP centers are buildings that are designated information centers where SNAP participants can register for the drone food delivery program and aim to help SNAP participants learn better budgeting practices and have a better grasp of nutritional information by offering classes or informational pamphlets. These SNAP centers can also alleviate potential customer service issues with either SNAP or the drone program. In conclusion, our solutions are to use SNAP centers to increase community education and drone delivery adoption and utilize either an aerial or ground-based drone delivery program to alleviate potential walkability issues in applicable areas. We as a team would like to thank everybody for their contributions.